Hi, my name is Bree Cowart, and I am doing a presentation on an article that I found um, for Nursing 7252. It is called The Effectiveness of Mindfulness-Based Cognitive Group Therapy on Cognitive Emotional Regulation of Patients Under Treatment with Methadone. It is done by Ismaili Kodati, Narazi, and Miri 2018, and it's April 25th, 2021. So what's the background of my study? About 1.5% of the Iranian adult population is estimated to use opioids. This is the highest rate on a global scale. So in order to understand my study, we need to know what emotional regulation is. This refers to actions that are adopted to change or modify an emotional state. Some non-adaptive and negative emotional regulations that patients with um, opioid use commonly use are self-blame, rumination, and catastrophizing. And through this study, they have shown in the past that mindfulness-based therapy can help improve this emotional regulation in which they need. So mindfulness-based cognitive therapy focuses on the present time. It's non-judgmental and it's unexplainable consciousness as opposed to an experience that enters the realm of an individual's attention at a certain moment. This concept includes admitting such an experience and accepting it. Evidence shows that mindfulness-based cognitive therapy helps with stress and anxiety management, reduces suicidal thoughts, reduces addictive behaviors, reduces the negative effects of impulse, prevents relapse of depression and insomnia symptoms, reduces pain in cancer patients, and the more intense the mindfulness, the less the alcohol, tobacco, and drug abuse would be. So in the study, the group type, they used a quasi-experimental design with a pre-test and a post-test. There were two groups, the experimental and the control group. The hypothesis was that mindfulness can be effective in improving emotional regulation and decreasing negative cognitive emotional regulation. The participants for the study were Iranian men with substance abuse disorders. They ranged from 30 to 35 years old, and they did not have any diplomas. And the duration of their substance abuse, was 2 months to 12 months, and they underwent methadone maintenance therapy. There were 60 individuals who were selected randomly and allocated to the experimental and control group, so there was 30 per group. The exclusion criteria, they excluded people who had regular use of antipsychotic drugs, inability to answer questions due to physiologic and psychological problems, lapse, and positive results for random drug screens for opium, amphetamines, and cannabis. Bupropion and the absence of more than 2 training sessions were excluded from the group. Women were also excluded because of their small numbers. The setting was at 2 outpatient methadone clinics in the city of Mashdad who were affiliated with Mashdad University Medical Sciences from 2014 to 2015. So how often did the group meet and what was the duration of the group? The experimental groups underwent a 1.5-hour session of therapeutic intervention, which was held once a week for 8 weeks. The independent variables were mindfulness training, and the dependent variable was emotional regulation. The tools they used were cognitive emotional regulation questionnaire. The questionnaire contained 36 graded items that assessed 9 cognitive strategies. These included blame, acceptance, rumination, positive refocusing, refocusing on planning, positive appraisal, putting into perspective, catastrophizing, and blaming others. The findings of the study, the results were used with analysis was conducted using an SPSS 22.0 format. There was a significant difference between the control and the experimental groups in the post-test and follow-up test scores at a significant level with a p-value of less than 0.01. In conclusion, they found that mindfulness-based cognitive therapy enhanced positive and decreased negative cognitive emotion regulation strategies for substance abuse disorder individuals. They also found that 48.2% score variance with positive emotional regulation and a 64.7% score variance of negative emotional regulation. These findings can be translated into practice easily by doing a pre-test and post-test format after having group therapy. So what were the limitations of the study? So some of the limitations were that it was a small sample size, there was a lack of follow-up period afterwards, and the entire sample was male, which makes it less generalizable. So the limitations will impact the ability for me to use this article just because of the lack of sample size. And so I would need to have further research that contained larger populations with maybe a randomized control study, and then have further research in both sexes that will need to be necessary as well. So really all of the curative factors as presented by Yalom should be used in group therapy, but specifically with this type of group that's dealing with methadone and substance abuse, some particular factors that I want to hone in on are universality, the feeling that the person's not alone, that there's other people that are going through the same issues that they're going through. So that would be important with this type of therapy. Also imparting information. As you can look here in the sessions that they did, they are teaching different coping mechanisms for mindfulness and things like that. So they are definitely imparting the information to obstruct the destructive thought processes by using explanations as to what's going on and why they're feeling that way. So that's a very important one when dealing with this. You know, when you're coming off drugs, you're definitely, your body's going to be completely different than when you started it. So they're going to have to go through and explain to the people why they're feeling this way. Next, development of socializing techniques. So members learn from each other about how to correct chronic and maladaptive social tendencies. So, you know, that's very important, especially with people who are having problems with drug abuse. You know, if they go back into the home and with other people that are having the drug abuse, that's putting them right back into that maladaptive social tendency. So they really need to be in to learn, you know, what is maladaptive and how they can adapt. What can they do to change their environment so that way when they return back home, they fight the urge to, you know, do drugs. The next thing is catharsis. Group members become able to express deep emotional feeling states, a process that appears to foster profound feelings of release and recovery. So seeing others who have been through it, have made through it, you know, that really encourages others to continue the process, you know, and to see the results that have come out from not doing drugs or the abuse. And lastly, existential factors. Awareness that everyone is ultimately responsible for how he or she lives their life. So that's very important because, you know, ultimately that's how, at the end of the day, that's what they're, you know, how do they want to live their life? You know, that's either they're going to continue the way they've been doing it or they're going to make some steps for changes. So here's a video link that I found that tells, you know, kind of in detail about mindfulness, cognitive behavioral therapy, and group sessions. And she just kind of does an overall generalized, detailed approach that I really like about it. These are my resources, and you have a great day.